Hi, Michael. Thanks for having me on.
You're very welcome. So let's talk about diabetes and swelling related to diabetes and the treatment.
Well, I mean, the big thing, obviously, the big problem, if you like, with diabetes is the vascular damage that's associated with the disease. You know, and the side effects of that can be swelling, and it can be tissue damage as well. Tissue necrosis, so death of tissue, and you know, we all see those horror cases of people having to have toes and fingers amputated. That's a worst case scenario, and it's quite uncommon, but it can happen. Yeah. So the big thing with diabetes is to promote tissue health. You know, and the best way to promote tissue health is to maintain the elasticity in the vascular system, in the blood vessels and in the venous vessels and the lymphatic vessels. And a really good way of doing that actually is by maintaining movement in the tissues and changing the pressure in the tissues. So you're changing the pressure flow of the fluids. From a manual therapy perspective, we do that, you know, with manual therapy, and we do that with massage and those type of approaches. But, you know, if we're talking about the products that recovery systems sell, and obviously the intermittent compression is a great adjunct therapy, I think, for that, because it can be used regularly. And its real benefit is that because it's intermittent compression, it's causing a change in the pressure in the vascular system, which has been shown to improve the health of the actual blood vessels. So it can reduce the risk of tissue damage, I would say.
Yeah, cool. So with the range of products, some are very portable, because we realize many patients need treatment more than one time a day. So having something very portable is very convenient for them to take, including a battery version, so that they're able to seek treatment at any time and any place as well.
Yeah, I think that's a great thing to do. I think it's a really potentially very useful tool to improve tissue health, you know. And as I said, the issue with diabetes, obviously, as well as working with your specialist and your doctor and managing your blood sugar levels, etc., and dealing with your physiology from a medical perspective, is thinking about tissue health. So thinking about exercise and movement, thinking about maintaining as good a tissue health as possible. And I think intermittent compressions, as I say, is a useful tool to use for that purpose.
Okay, so thanks very much, Dr. Paul. Great to be partnering with you in terms of patient health, particularly relating to diabetes.